Ready? Good afternoon, everyone. My name is Stoffel. I'm a patient experience consultant. It's a job I didn't know existed until I got it. So my colleagues and I, the other members of the team with my name, take all the patient surveys. You will be meeting patients and you will be impacting their impression of the care they get here at Emory Decatur Hospital. I start judging the hospital from the time I park my car. I know nothing about medicine. I couldn't tell you where my spleen is, and I don't know what 20 milligrams of dextromethorphan will do to my body. And the only way I can judge whether I picked a good hospital and whether I trust my doctors and nurses is the vibe I get from them. I just did some training with some nurses this morning, and I said, it's so strange. I'm sick, I'm in bed, I'm having some procedures done, and you know that I'm watching you all and watching if you like each other and like being here, because that's how I have trust in the care you're giving me, because you're way brainier than me. I didn't go to nursing school. I don't know the amazing things you all know. So keep that in mind as you interact with our patients and their loved ones. I'm a big believer in keeping it real, and I say the C word sometimes, which is customers. Our patients are our customers. In some cases, our customers, the ones watching the care we give and choosing where they send mom and dad, are the sons and daughters of our patients, or the best friends of our patients. So as you move about the hospital and start your role as volunteer, remember to include everyone in the room. You never know who's really the one really watching, the one really kind of evaluating whether this is indeed an Emory level experience or not. So we'll spend half an hour or so together, and we'll talk about your communication style. I'll give you a tip that will serve you well as a volunteer, but I think throughout the rest of your life as well. And then we'll do a few role plays and get you all up here and interact with me portraying a student. We might have Karen, portraying a patient. We may have Karen do it as well, and give you a chance to kind of flex that muscle a little bit. We're going to start with the video. Oh, maybe not.
Oh.
Did you have to click the start button on
I
it?
think so. And I'm assuming the volume is up on it? Everything was new in there. The control click?
I'll let you have at it. I know where it is on the shared drive, if that would be.
Yep, let's do that because it's not.
Okay.
Let's see. There you go.
Is it on the shared drive or is it on the cloud? It's probably in the cloud. You know, if you only have half an hour, I think I'm
We can
fine
skip it?
skipping it.
Okay,
Yeah, I
that's
actually
fine.
think I'd rather spend that time
Sure.
really doing it. So we have a video we show sometimes. We'll skip it today. We only have 30
I'll
minutes.
send y'all the link.
I'm sorry?
I'll send them the link.
Okay, sounds good. Yeah, watch on your own, because you might start crying too. So let's not get it too real. It's an intense but a beautifully done video showing both patients in the hospital and workers in the hospital, and they all have a cloud over their head. It kind of reveals the secret story everybody carries around with them all the time. Just found out the tumor was cancerous, and then he's passing the escalator, the tumor was benign. And it just tells the story of the truth that everybody is carrying their entire lives with them when they come to the hospital. I told you I did some training this morning with my colleagues, and I remind them sometimes that they chose to go into healthcare, which is way different than making pizzas and selling sneakers. This is, I don't mind saying, sacred ground. Within these walls, people are born and people overcome disease and people die. And this is real world, real intense stuff. So our care should match the level of intensity of the incredible life-changing things, joyful and tragic, that happen within these walls. And you all are volunteering to kind of step into that world. Now I'm not clicking. There we go. This is Emory Healthcare's care transformation model, a graphic that I simply bring up to show that Emory Healthcare is committed to keeping what at the center? Patients at the center of everything we do. In the way we design our facilities, in what rooms patients may have to walk past to get to another place. What story does their way they move through the hospital tell them? Karen helps develop a team of people who are community members who agree to help us bring the voice of the patient to rather high-level committee meetings. And we tell those people, be an irritant. When you find that executives and the healthcare leaders pushing something through, your job is to bug them and to tug on their hemline and say, wait a minute, as a patient, if you're asked to do X, Y, and Z, I'm going to feel this certain kind of a way. So their job is to always remind us of what we have the center of our care model, which is the patient. Is every decision we make patient-centric? That's who we're here to serve. One thing that my team does, in addition to taking survey reviews of our patients after they leave the hospital, is we field complaints and grievances of patients who are in the hospital right now. So take a stab at it. Where do you think that my colleague's phone rings and says, hey, what's going on?
I feel like they make complaints about people not caring.
People not caring. Anybody else got an idea?
Kind of similar, but like everyone had their head down.
Yeah, okay, great, yes.
And inconvenience in this facility.
Okay, this place is spread out. I can't find where I'm going. It's not designed well.
Wait times?
Wait times, sure. What else do people complain about at the hospital?
Money.
What?
Money?
Money, how expensive it is.
Adequate quick care.
Adequate care? Yeah. Are my concerns being taken seriously?
New food.
Food! Hospital food! Very often, you all, when we get a complaint and it's taken seriously about hospital food, we could go and check the medical records and say, guess what? They have a restricted sodium diet. No wonder they didn't like it. They're over-salting their food at home, or they have a condition we have to keep it kind of bland or easy to eat. Sometimes you have to make food that's specially designed to not be aspirated with certain patients. So those are all factors. The answer is you're on the right track. I'll share with you what they really are. Lack of courtesy and respect from the care team is number one. Number two, poor communication from the care team. I didn't know what was going on. I was given a pill and wasn't told what it was for. Or I met someone and they just came and started working on me and I didn't know who they were. Only last do we find out that people are really concerned about their care. I was misdiagnosed, or I don't think this treatment is the right one. And inevitably, you all, when we have someone with a third issue, they say, my doctors and nurses are telling me the wrong thing. When we get 1 and 2 right, we treat them with respect and we bring the team in at the bedside and we talk them through, they have the aha moment. Oh, okay, all right, I thought such and such. If we do 1 and 2 right, if we treat people with respect and courtesy, and if we narrate our care, if we tell people who we are, what we're doing there, and how long it's going to take, we gain their respect and trust. We're going to practice now. I'm going to do a quick lesson on, and then we'll get a chance to practice live, a technique that we are committed to inculcating in all of our people all the time. I wear a badge to remind myself to do it every patient, every encounter, and that acronym, which will serve you well, you all, if you have a job interview or you're meeting a new person at a college party, you'll remember AIDETH and you can adapt to the situation. So this is the acronym we want you all to love and learn and live during your time as a volunteer here. The A stands for acknowledge. I can't begin any human interaction unless I am seen by you. Take yourselves out of healthcare. Tell me a business or a company or a store that does a good job of acknowledging you as a customer.
Chick-fil-A.
Chick-fil-A, classy place.
I say Publix.
Publix does a nice job. I agree with that. Right around the corner from us, you all, we have a burrito place called Moe's. When you walk in the door, they say, "Welcome to Moe's. Welcome to Moe's." They make acknowledging you part of their brand experience. Very clever. My model of what not to be like always is Home Depot. You cannot, those orange apron people walk right past you at Home Depot. They do not, and if they don't see you, they don't have to help you with something. And you have to flag someone down to get some service at Home Depot. So nothing can happen until I'm acknowledged. Sometimes we walk up to a desk, and some of you may be in a role where you're at the front desk or at the nurse's station, and you're busy with something. If a loved one comes up to you at the desk, you can acknowledge them with your hand, with your doing this, with the phone in your neck and typing on the computer by nodding. You can tell from a nod if someone says, "I see you and I've got you." Doesn't have to be a big long speech, but a greeting. "Hello, good morning. Welcome to Unit 4200. makes me know, okay, somebody's got me and I've been seen and I will be helped. So everything starts with acknowledge. Eye contact. Good day. Happy Thursday. How's your day going? Gorgeous weather this morning, isn't it? It is not inappropriate for you to introduce yourself. I think for those of you who are volunteers, it might be especially important to know not only your name, I'd like to address you by name if you tell it to me, and what your role is and that you're a volunteer, but you might also be telling me what you don't do by me knowing you're a volunteer. I'm not going to ask you for my next pain pill if I know you're simply a volunteer here at the hospital. So do I need to know your last name as a volunteer?
No.
I think probably not. I don't think your interactions are going to be as much. If you get to know someone over time, that's up to you, but I think my name is Steve. I'm a college student near here, and I'm a volunteer working on this unit this week. How may I help you? I think that's fine. Introduce yourself. Tell them your name and your role. If you want to tell them where you go to school or why you're a volunteer, that's next level stuff. That might be interesting too. What I'm looking for is humanity, a way to make a connection with you. Healthcare is all about connecting, and AIDETH is a tool to help you do that. If you want to take a stab at the D, it means how long something lasts. Duration. Duration simply means how long something is going to take. I don't know if you all will be doing anything like taking down some information from someone. You may be asked to go get something for someone. Hey, little volunteer person, I'd love a ginger ale. Can you get me one? I think it is next level an Emory brand experience for you to say, I'm going to check your record to make sure that that's allowable for you. If so, I'll be back with a ginger ale in 15 minutes. I'm not a fan of just a sec or I'll be right with you. Because just a sec to me means something very different from somebody else. I expect you to be immediately back. And you meant 5 minutes. So avoid terms that can be interpreted differently by different people. We call it a hard time. Give it a hard time if you can. Tell them really when you'll be back. Healthcare is random. You can think you're going to do something and you step out of that room and you get pulled into something else. So we encourage people to under-promise and over-deliver. If after a while working here or being a volunteer, you say that usually takes me 15 minutes to direct someone down the hall to such and such a room, I'm going to say 20 and I'll be a hero when it's 15. But if I say I'll be back with your Coke in 10 minutes and it's 12 minutes, I've missed the mark. Because they're timing me, because they're at bed, they have nothing better to do than to start the timer. So make sure you under-promise and over-deliver. I give people credit as we do role plays and I check people off on performing their AIDETH if they give for the duration what happens next. So you can imagine someone who's a phlebotomist who draws blood. I don't know how busy it is in the lab downstairs to analyze it, but if you tell me, after I draw your blood, we're going to send it through the vacuum tube system down to the lab, someone there will process it. If you have history and you know how long that takes, that's great to say, but once that's done, the doctor will read those slides and be able to determine the right antibiotic to put you on. I don't know, I'm making it up. But telling someone the sequence in which things happen is another kind of duration. Today you're coming for a CAT scan. You're going to go down to the imaging unit. They'll have you change into a gown. They'll take the pictures. That usually takes 5 or 10 minutes. And I know those slides will then be sent. They'll be part of your medical record for your doctor to read them. Tell me what's happening. This is about my body, and it's personal to me. Very closely related to duration is the why of what you do. It's the explanation. The risk in the nurses and the patient care techs I coach is they know these things so well, they forget that I don't know why they do the things they do. And I remind nurses and techs and those who are used to the hospital setting, this is the planet Mars to me when I come here. I'm an earthling, and when I walk into a hospital, that's a scary place for me. It has different sights, sounds, smells, even the language is different. So something that nurse does 1,000 times a day is the first time I've ever had it done. So talk to me, talk to me, talk to me. Explain why you're doing what you're doing. Beware of medical acronyms or jargon. And I'm going to feel embarrassed to say, I don't know what that means. I'll tell you all a story. Are you familiar with an acronym in healthcare called NPO? You know what NPO means? What does it mean? I'm NPO. What does it mean if I'm NPO?
Can't feed
It means I can't eat or drink anything. It's a Latin phrase that means like nil per os or something like that. Nothing by mouth. Some time ago, a former boss of mine was rounding on some patients. She went into a patient room. It was an elderly woman was the patient, and her husband was at her bedside, and she picked up the vibe in the room. They were pleasant, but she read the concern in their face and in the way they spoke. Very sensitive. That's something you all are called to, is to pick up on those nonverbal cues. And the visit went fine. She said, what's going on here with you two? Can you share with me what's troubling you? She picked up on it. And the husband broke and said, my wife has something very seriously wrong with her. She has a condition and no one's telling us about it. We don't know if it's fatal. We don't know what the treatment plan is. And my boss was concerned and said, well, I'm so sorry. Can you tell me more? He said, she has something called NPO. Everyone who comes in is mentioning that she's NPO, and we don't know what that condition is, how serious it is. All it meant was that she was going to have a scan and she couldn't eat. But you know what the human brain does? When I don't know what something means, I go to the scariest possible reason why a code is being used around me. If you've ever been around people who speak a language other than English and they're speaking, they're talking about me. Why do we do that in our brain? We jump to the worst possible conclusion. So watch those acronyms and the phrases that you become so used to, because that's Martian talk. And we Earthlings need to know what it means in plain English. So explain why you're doing what you're doing. Always, if possible, from a patient-centric perspective. Sometimes we train nurses and we talk about patients who can't eat anything. And I say, tell me why I can't eat anything. And they say, well, because of the scan. Tell me more. Well, you're going to go have surgery. I don't know what that means. Well, when you're out, you can aspirate the stuff. You can vomit. We want your stomach empty. Oh, now I get it. Now I'm in. But find a win for me in why you do the things you do. The T of AIDETH is thank you. This is what Chick-fil-A does very well. My pleasure. We forget sometimes please and thank you. And I would like to encourage you all as volunteers to be a please and thank you culture, not only with the patients, but with the people you'll be working with. That's the class level we look for. It's so strange, y'all. I can buy a chicken sandwich at a multitude of places. I can buy one at Chick-fil-A. I can buy a chicken sandwich at Crystal. One of them makes me feel elevated and happy and optimistic about the world. One makes me feel kind of gross and kind of yucky and like, I'm a cog in a machine. Please and thank you and I'm sorry and how can I help you and yes ma'am and yes sir and all those things we learn as kids are an important part of the perception people have of the care we give. So don't forget common courtesies. And whenever you have an opportunity to thank someone, thank them. Thanks for letting me help you today. Thanks for this conversation. I learned something today I didn't know. Be thinking about how you can show gratitude to people. People are hungry for it. And I think you as a volunteer bring a unique lens to the unit you'll be working with. So don't talk yourself out of saying thank you. I think we do that sometimes. H is hand hygiene. So the AIDETH acronym is pretty common nationwide, but here in the DeKalb Operating Unit, Emory Decatur, Emory Hillendale, and Emory LTAC, we've added a physical gesture to it. And the idea is, while I'm sanitizing my hands, that's my cue to sanitize the relationship by sending things off with this person I haven't met on the right foot. So it's important that we keep our hands clean for disease prevention, for ourselves and our patients, but it's also a good cue to go, here's where I start my acknowledgement introduction as I'm sanitizing my hand. It's a frozen moment anyway. To say, as I clean my hands, I want to introduce myself to you. My name is Steve. I'm a volunteer here. I've been in this unit a couple days, but I'll be here until 7 tonight, and maybe I'll get to see you again after this visit, et cetera, et cetera, et cetera. Sound doable? I check people off on this all the time, and after we talk about it, I say, now, forget the stupid letters. I'll tell you what AIDETH is. It's called loving on people, to use a Southernism. Go up there and love on them. Go love on them. Talk to me, talk to me, talk to me, and you've got this down pat. So I would far rather you leave out a letter and get the spirit of AIDETH right than robotically obey every letter in a very scripted sounding order, because that's going to cheese me off. That's going to sound like you robotically memorized something. And I want the spirit of it. I want the heart behind it to come through. not the slavish performance of every single letter. A big part of this is listening. You all, we all study different things. We have different levels of education and different degrees. Every person who's ever lived has a PhD in something, and that is BS. We can read BS, and we can read when we're being gamed or when someone is kind of doing a technique on us. So I know when you're listening to me. I know when you're engaged. I know when there's someone home. You ever meet someone, they're just dead, their eyes are dead, there's nobody there. But we need your energy, we need your vitality, and we need you to listen to us. So our patients and the people we work with on the units know when you're listening to them. You're making eye contact, you're appropriately nodding, you're asking for explanation when something goes over your head. So we read it very well when people are listening. The other half of communication, AIDETH is about what you say. This needs to support AIDETH too. What a cute little kitty. He's even got his hand on his head like that. So, here's how you might use AIDETH and adapt it to your role. Anyone, do they have assignments yet? Does anyone know yet?
Several
what
of
they're
them
gonna
do, yeah.
Anybody going to be greeting the public in any of your roles?
Is anybody in
know yet?
DIC? You are. Okay.
DIC, Diagnostic Imaging
Imaging Center.
Center. So people might come up to you, and you could, for instance, so the part of the acknowledging is looking for people you can help. This would be a big part of your role as volunteers. I did it yesterday. I passed a guy, and lots of people passed him, and I read that he was looking for something. And I said, sir, may I help you find something? It's not my job, but I want this hospital to treat the community well. Yes, I'm looking for the such and such. I don't know what it is, but let's find out together. I promise you, I said that yesterday, y'all. I've worked in this hospital for 13 years, and I did not know where he was looking for. It's a maze. I said, let's find out together. I leaned into my weakness. I said, I don't know what that is, but you and I are going to find out together. And he beamed, and we went in our little wild goose chase, and we found where he needed to be. So we smile and make eye contact, and we say, may I help you? My name is Steve. I'm a volunteer here. I'm a volunteer in this unit. And you know what? When you let people know you're a volunteer, they're not going to expect you to be an expert. They're going to warm to you as someone who volunteers his or her time. But I think that's appropriate to lead with that. I'm a volunteer, but I'd be delighted to help you find what you're looking for. I need to talk to my nurse. Here's the duration. The nurse is helping another patient right now, but I know they'll be right with you. Can I get you a magazine while you wait? Good something to help them fill the time. One of my favorite things to say about duration, if it's out of your control, is to say, the doctor just started his rounds. I'll make sure he doesn't leave without coming to see you. That's really what most patients need is, I don't want to be forgotten. Will I be forgotten? And you saying, I got you. We're not gonna let that happen on my watch. You're good to go. Explanation, I'm sorry about the wait. An emergency came in unexpectedly. Is there anything else I can do for you in the meantime? In both these cases, the patient is looking at the comfort and care of that guest. And thanks for letting us take care of you today. It was good meeting you. Thank you for your patience. Is one of my favorite ones in healthcare. We talk about wait times. I've been waiting. I know it's a drag. Thank you for your patience. One thing I'm really encouraging our nurses to do this year more than ever is to acknowledge the emotion the patient is feeling before we fix the problem with a drug or a technique. We just did a role play this morning, and the pretend patient said, oh, I've got a miserable headache. And the nurse said, well, let's get you 20 milligrams of such and such. And I said, stop. This is another human being who's in pain. And I know you're good at fixing stuff, but for a moment be human and say, I'm so sorry, headaches are the worst. What a drag. We're afraid to say those things, but that lets me as the person with the headache know she gets it. She heard me. She's feeling my pain. I need empathy. I need that connection. We can worry about the medication in a second, but take just a moment to check in with me feelings-wise. So keep that lens on as you start your time here as volunteers. Rocket science or pretty obvious? I think you got this? Let's practice. So we're going to, I'll begin by portraying a patient. We may loop Karen in as well. We're going to be nice people. And we're going to have you all do your best stab at coming and, as I said earlier, loving on us. So we'll practice. If you're not up, if you're not one of the volunteers, watch your peer, and we're going to, as a group, tell this person what we thought they bring. What I want to see is your personality and your energy and your positivity and your spirit of helpfulness come through. Don't worry so much about the letters. We can talk about them, but I want you to see you greet me and help me and serve me in a way I would expect a volunteer to do so. So here's our, I think we have 3 scenarios, Karen. Here's our first one. So who wants to come and help me find medical records? All right, come on up. You don't have to know where medical records is. We'll just kind of, or we'll say it's over by that podium. How's that? That's medical records, but I'm going to meet you way up here. So you want to be behind the desk maybe, right upstairs at the front desk? And I'm going to come and talk to you. And here's my form they gave me. And is this the front desk?
Yes, it is. My name is Lenise.
I'm sorry, say it again?
Lenise.
Lenise.
Yes.
Oh, that's beautiful.
Did you need help?
Yes, please. I've got a CAT scan image I have to take. I'm moving to Schenectady. I got to take this image to my new doctor physically.
Okay.
It's at medical records, and I have no clue where that is.
I will be happy to walk you to the direction
You'll
need to go.
take me there?
Yes, I will.
Cool. Let's rock and roll.
Come on.
All right, let's go. We're walking.
How's your day going?
When I get this X-ray done, it'll be a lot better. How about you?
My day is going excellent. Thank you for asking.
How long have you worked here?
I'm actually about 2 years.
Really?
Yes.
What do you do in your real life?
Um,
When you're not volunteering, what do you do?
I go to school.
Okay, what do you study?
I'm pre-med.
Whoa, okay. So you're learning the ropes before you become a doctor. I like that.
Yes, I am.
All right. So what I really want Vanessa to do to take the next level is I want her to do a handoff to me now that we're medical records. So here's Joe back here at this desk.
Hello, Joe. We have another patient here that's actually needing to come to medical records and need your assistance. Are you able to assist them?
Yeah, we happy to do.
Perfect. Did you need anything else?
No, you're a rock star. Thank you so much. Appreciate your help today. Boom, 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 All right. Everybody but Vanessa, what did she do well? What did you observe her do?
She's very nice.
Okay.
Open.
Okay. Approachable. What else did you see in her style?
You know, we're walking, she asked how your day was.
Oh, good. Nice. I can't stand it. Because how creepy is it to walk for 5 minutes in utter silence? It's just human. You just start a little chat going. Very well done. Anything else you observed?
It was just very warm. Like, it felt comfortable.
Didn't felt cheesy or scripted or corporate, did it? Felt like 2 human beings talking to each other. Great job.
Thank you.
You passed. Let me know when you're a doctor. I'll let you treat me.
Exactly.
Anything you observed, Karen, about that exchange?
And telling that you're a volunteer and your name, again, that just kind of makes you human, and it also sets those limits where they know that you're not going to be the person treating them, but yeah, they understand that you're here because you want to be here, not because you have to.
We have 2 overlapping brands here. You're an ambassador for Emory Healthcare, for this hospital in particular, for whatever unit you may land in, but you have a personal brand as well too. And I learned about this brand by the way she treated me and the way she carried herself and the professional and confident way she acted. You all, I guarantee you, if you haven't had it yet, you will have moments in your career, but specifically as a volunteer, where you will not know what the heck you are doing. I actually hope that for you, because you will learn the secret of the universe, which I'm about to lay on you right now. Karen knows where I'm going with this. The secret of the universe is everybody is faking it. Did you know that everybody's faking it? Did you know that the President of the United States is faking it, and the President of this hospital is faking it, and Steve Stoffel is faking it, and Karen Kaufman is faking it? It's called being human, you all. And we do this really awful thing to ourselves, and we look at that guy over there, and that girl over there, and we say, how come they've got it all together? And I don't, and I'm this bumbling idiot who's making it up. Everybody does the best they can with the knowledge that they have, you all. So give yourself the gift of acknowledging I'm gonna fake it. I'm gonna pretend to be more confident and comfortable than I feel the first week or two here. And the amazing thing will happen is you fake it the first time, you fake it the fifth time. By the 10th time, it's a lot less fake. You start to have some mastery over it. You start to know where things are, and you start to say, I can approach a stranger now and engage them in conversation. Something that scared the heck out of me 2 weeks ago. So we fake it till we make it. But don't ever put yourself down. And the best way to manage the fact that we're faking it is to lead with your weakness. Is to do what I did the other day and say, I honestly have no idea what that is, but let's find it together. That thing that you're the most ashamed of not knowing, when you name it and you open with that, it takes its power away from you. You say, you know what, I got news to tell you. I'm a volunteer, this is my first day, and I'm scared out of my pants. And once you say that, you say the big ugly thing, it doesn't have the power over you. It did when you felt like you had to keep it all together and act like a performance of somebody who's competent. Open up with that. You know what it is? It's endearing. I'm going to fall in love with you if you're vulnerable with me in that way. All right, well done. We got round one, round two. Where's my
Quick
clicker?
smile
Here it is.
too.
Next scenario. Oh, let's make sure we hit these talking points. Anything that you'd like to add to what how we loved on you? How scary was it to perform that role?
I was actually really scared because I had some dental procedure on my on my mouth. And
Uh-huh.
I was like, I hope like I can talk properly. And
I picked up on nothing. I picked up on your warmth and your positivity and your willingness to help. That's all I saw. Was it infused effectively, you all? I thought the handoff was nice. I kind of threw a wrench in the works basket and hand me out, but you did so beautifully. Did she listen to me? She made good eye contact on the little walk. Okay. Well done.
thank you.
Scenario 2. Woo. Wheelchair?
Yeah, wheelchair right
You want
there.
to be in the wheelchair?
I'll let you do the wheelchair one.
Okay, I'll be
Yeah.
in the wheelchair. You're going to come in my room. Who wants to go on this one? Here I am in my wheelchair.
Dean, this is actually something that you're gonna be doing too, so, well, she's gonna come give a shot. Yeah, you're gonna observe, huh?
So what I want you to do is, I'm going to be in my room. Will you do me a favor and knock? And will you be so classy that you wait for me to invite you into my room?
Yeah.
Because my whole life is out of control right now. And when you give me the courtesy to let you ask me into my room, I feel like this is a little bit more of my home. And then I would like also to ask you to play act sanitizing your hands in front of me. All right, knock when ready. Come in.
Hi, Mr. Steve. How are you?
Well, I'm okay, thank you. How are you today?
I'm good. My name is Rima. I'm a volunteer here at Emory Hospital.
Now, tell me your name again.
Rima?
Rima, like it rhymes with something.
Yes, exactly.
Okay, good, I can remember that.
Do you need any help?
They told me I've got to go down to some place. Maybe it's not in their orders of where I'm supposed to go. I guess I'm supposed to go to the Diagnostic Imaging Center.
Yeah, I can take you there.
Thanks, but my legs don't work, so.
I can push you.
Okay.
Are you already in the wheelchair?
This is my wheelchair. We're going. Is it too much? Okay, great.
I don't know.
It's right back there. There's Diagnostic Imaging Center.
How are you? I'm sorry.
That's okay.
How was your day then?
It's been good. They say I can get out of here in a couple days. We're just telling everybody out here. Okay, here we are with Diagnostic Imaging Center.
All right. We're here now.
Okay. Now, are you going to come back and get me? They said it was going to be here for 30 minutes.
Yeah, I'll be here in 30 minutes.
Okay.
My name is Rima again.
I remember.
I'll be here.
I know. Rima. That's
Like
how I
rhyming,
remember it.
exactly.
Yeah. And what department do you work in here?
I'm just a volunteer here.
Oh, don't say just. That's important. That's an
Thank
important
you.
job. Never say just.
Thank you so much.
Thanks for volunteering. I'll see you in 30 minutes.
All right, I'll see you.
Okay, bye-bye. All right. Cheers for Rima. Sorry about that. Poor mechanics of my wheelchair. This is a loader. That thing does not steer well. Rima, you start. What do you think you went well in that encounter?
Greeting you.
Greeting me. Rima, I'm going to ask you to do something that's difficult for people to do. Tell me what your gifts are. Tell me one of your gifts in human reaction. What have maybe other people told you is a gift that you bring for the way you interact with other people?
I don't think I displayed it well because it's not really a natural environment, but I've been told I'm a really good people person and I'm really good at talking with others.
I don't doubt that for a minute. It came across in your energy and in your smile, Rahima. To say what your gifts are is not to brag about yourself. It's simply stating a truth about yourself. And sometimes, if we're hard on ourselves, we know it most by what other people have told us. So you absolutely are a people person, and I got warmth from you right away. Anything you wish you would have done differently in that encounter?
I think I ended it a little awkwardly. I guess with experience, hopefully I'll do better.
Well, we're doing a dirty trick on you, dumping you into the deep end of the pool without any kind of grounding at all. So once you get to know me, and whether you know it's your job to bring me back, I know for certain you're going to say, and Mr. Steve, in 30 minutes I'm going to meet you right back here and take you back up to your unit. You'll get that
Okay,
in no time.
thank you.
You all, was AIDETH used effectively? Yes,
I feel it was. She said everything with a smile on her face.
100%. 100%.
You're welcome.
I got the idea that she's enjoying her job as a volunteer, and that matters to me as a patient. Do you have something to add, Karen?
No, I
Okay.
think she'd be great.
She listened to me. I can tell you as the patient, she listened to me. And I could feel her listening even when she was behind me. The conversation was going, but she was engaged and fully present. Tricky thing to maneuver, but just like was modeled on our first one, fill that gap with chat. Where you're going to school, what it means to be a volunteer, how long you've been a volunteer, what part of town you live in, the weather, all those safe things to talk about are fine. One more, let's have you volunteer before you see what the scenario is. Who wants to go next? And then we'll show you what the deal is. It won't be bad. Who wants to try our last one?
I'll do it.
Okay,
Oh,
come on up.
You got it.
all right.
You are going to come and check in on me. Okay, you want to be the patient?
Sure.
All right, Karen, you're the patient. You're just doing a comfort and care round. She's in the hospital bed, and we're just going to come in and love on her and see what she needs. And knock and sanitize your hands when ready.
Come in.
Hello, how are you?
Hi, I'm fine. How are you?
Good, I'm Dean, I'm a volunteer here.
Nice to meet you.
What's your name?
I'm Karen. Nice to meet you.
Sarah, nice to meet you. Do you need anything?
You know, my feet have been really cold today. Could you maybe give me some socks?
Of course I can give you some socks. Let me just go check real quick where they are.
Okay, thank you. And while you're gone, can I also get a ginger ale with you?
Let me check with your nurse and see if you can have one.
Okay.
And then I'll be right back.
All right, thank you.
All right. Here's your ginger ale. You can have
Oh,
that
good.
and
Thank
a
you.
pair of socks.
Wonderful. I appreciate it
Let
so
me know
much.
if you need help with those. Get
All
them
right.
on.
Thank you, thank you.
All right, take care.
All right.
All right.
It's like a little like intimidating because it's like
Sure it is.
unnatural, but
Sure it is. You mean this setup? you mean?
Yeah.
Yeah, of course. And you're being watched by a bunch of people, and sure it's intimidating. But you did great. So what do you think went well in that encounter?
I don't know. I think I did all right. I think I did all right overall.
I do too.
I think I talked well. Maybe better eye contact next time.
Patient, how did it feel having him come visit you?
You were smiling and you were friendly, and so I felt like you were caring about me as a patient and what you could do to help make things better. So, yeah, the eye contact was good. You were plenty loud where I could understand you and hear you. You weren't like somebody whispering. So I think being loud enough, especially for older people, sometimes they don't have their hearing aids in, you know. So keeping that volume up was good.
I feel like he did well, especially when she said she wanted some ginger ale. He actually acknowledged it, and he also made sure to get permission from your nurse first before he give you anything. Once he got permission, then he came and handed ginger ale.
Very well done. For the safety of the patient, you checked that before you did it. Yes.
I think asking if she needed anything else or if she needed help putting the socks on was good. 'Cause
Yeah.
It's not just another checkbox, like you're actually trying to, like, not spend time with the patient, but like you're there with them.
I'd say yes, spend time with the patient, because you know what, the nurses on that unit have a gazillion things to do. This is the role that volunteers can serve really nicely at is, I've got some time to give you. Just like Karen said as I was walking in, you got that patient who you're just reading, they need some love, Man, that's a great one. And I would encourage you all, if Karen, if it's okay to say, if you're doing these kinds of comfort and care runs on the unit, if you can ask the nursing team who could use some extra love today, man, I think that would be really impactful. Who doesn't get many visitors? If you can stand in as that loved one, you're gonna be the grandbaby, you know, that's in New York City or in California that I miss so much by your presence. Did he listen to you?
Yes, he did.
I have two observations. One would be, I might, let me see if your nurse will, if that's allowed for you to have, is great. I mean, that's absolutely right. I'd say a lot of our patients are on dietary restrictions. As a volunteer, I can't mess that up. So you understand I'm gonna have to check and make sure that's okay to get you one. It's okay to sort of say the why behind that kind of thinking. In my training I did this morning, I'm sorry I keep harping back on that, most of the nurses who had to do a role play ended the role play with a very appropriate and nice wrap up, which is, do you need anything else before I go? As nice as that is a yes/no question, and the kindest patients you all know that the team is busy and they don't want to impinge on your time. My favorite thing to do, and I want you to try this on as you volunteer, is to say the scary phrase, what else would you like to talk about? That has a different tone than, do you need anything before I go? My reflex is to say, no, I'm good, because I don't want to bother you and I don't want to be a bother. But if you say, what else should we talk about today? That almost sounds like I'm opening something up rather than wrapping something up. And I want you to do something else that's scary and hard to do. In 2024, in Atlanta, Georgia, in the Western world, we are missing something so much called silence. I want you to get comfortable with saying, what else should we talk about today? And letting 3 seconds linger. That is such a grace to give the patient. It says, I have time for you to think of something, rather than let's move it on. Because when you're on the unit, I know my nurses and techs are mentally down the hall next room as they're wrapping up this one. Put your clipboard at your side, put your papers down, look in the eyes and say, what else is going on with you today? And just let that moment linger. It'll feel scary at first, you'll get comfortable with it, but people will fall in love with you in that gap because you're really present for them and you're seeing them and you're spending time with them. Hard to do, but that's a muscle I'd like to encourage you all to flex, that you have lots of chances to meet people during your volunteer time. Anything
That
else?
thing's-
Is that it for me?
I think so, yeah.
And any questions for me? I am so glad you all are going to help us out by doing this. We need connection. We need your youthful energy. We need the spark in your eye. You may get an assignment where you are exactly what that unit needed, even as a volunteer, you all. So healthcare is tough, it's stressful. Our teams work 7-hour shifts on their feet, and they deal with people in rough shape and with bodily fluids and stinky things and jabby, pokey needles and all that kind of stuff, and it's wearing. You all are a chemical catalyst that's going to get dropped into the units you volunteer. So bring light, bring energy, bring positivity, because there are some people upstairs in our patient units who are thirsty for just that gift you can bring.
Yep.
Thank you. Did I earn a cookie?
Yeah, if I had some, you could help yourself. Thank you.
Appreciate it.
Appreciate you, Steve.